Welcome to the Lentil Intervention Podcast, talking all things movement, whole food nutrition and environmental wellness with your hosts, Ben and Emma.
Hello everybody and welcome to episode 8. My name is Ben Adelberg and joined by my co-host Emma Strutt. Hello Emma.
Hello Ben, how are you going?
Very good, thank you. We're going to go straight into it, but first, two quick things. Firstly, if you're really enjoying the content in these podcasts, please do consider buying us a coffee. Head over to our website and you'll find all the details there. And lastly, if you are listening to this podcast on iTunes, please do consider leaving nothing less but a 5-star review, but to help us obviously improve our rankings and reach more people. So that's it. Emma, over to you. Who have we got on the show today?
We've got a good one today, and I'm a little nervous as I'm in complete awe of this guest's academic achievements and incredibly valuable contributions to public health advocacy. We are extremely lucky to have Professor Boyd Swinburn joining us today. Boyd is Professor of Population Nutrition and Global Health at the University of Auckland and Honorary Professor at Deakin University in Melbourne, where he established the World Health Organization's first collaborating centre for obesity prevention in 2003. Boyd has over 350 publications related to obesity. He has led 2 Lancet series on obesity and co-chaired the Lancet Commission on Obesity, which published its landmark report in 2019. There's many more feathers to Boyd's cap, but honestly, his impressive resume would need an entire podcast episode on its own. So I'll just bring you on now, Boyd. Professor Swinburn, thank you so much for joining us today.
Thank you, Emma and Ben. It's a pleasure to be here.
Now, we don't even know where to start, except let's start with this. You're trained as an endocrinologist, and you then transition to public health advocacy. So first, what is an endocrinologist and how did the transition come about?
An endocrinologist is somebody who studies hormones. So that's largely diabetes, thyroid disease, those sorts of things. And my main interest was in diabetes. And then I started doing some research in the US, in Phoenix, Arizona, where they have the world's population with the world's highest rate of diabetes. The Pima Indians live just outside Phoenix, Arizona, in a reservation. So something like 2/3 of that population has diabetes. And the NIH has had for many years studies trying to understand what the causes of diabetes were. What's the cause of this extraordinary high rate of diabetes? And of course, we were doing lots of studies inside the body, looking at the metabolism, at the hormones, at the genes, and so on, to try to understand what was happening with diabetes. And that is absolutely fascinating, I have to say, and that's why I loved endocrinology. It's a really challenging and fascinating area. But when you go down to the reservation outside Phoenix and you see the population there, the marginalized population, as all North American Native Americans are, you see the problems related to alcoholism, to suicide, to family violence, to all those sorts of things, imprisonment, all of those classic markers of a whole population which has been marginalized. And a penny dropped for me that the causes of these big problems that we're dealing with, including obesity and diabetes, actually lie within society, not inside the individual. Yes, sure, some individuals are more susceptible than others, but if you want the answer to the question about why is the whole world getting fatter and getting more diabetes, then actually looking inside the individual is not where you're going to find your answer. And so that's when I started thinking about and looking at the wider environment, especially the food environment, and trying to define what it was in the wider environment that is driving us towards obesity, which of course is the precursor to diabetes. And so I sort of came sideways into public health, really. And when I came back to New Zealand, I took a position as medical director of the Heart Foundation. And I kind of learned how to do public health in practice, really, in that role. And so, I haven't looked back. And so now I'm a public health physician, and I feel that's my calling, if you like.
And I've heard you say before that obesity is just a normal physiological response to an abnormal environment.
Yeah, that's right. And that was a penny drop moment for me. I do remember actually walking along the beach at the Bay of Islands when I was back to a visit with a family, and I was trying to put this into my head, and that kind of fell out. Obesity is a normal physiological response to a pathological environment. And then we went on and coined the phrase obesogenic environment to be more specific. And then we identified the specific components of what is it about our environment that is so obesogenic in terms of the physical environment, the economic environment, cultural environment, policy environment, and so on.
Yeah. So almost every country in the world is still increasing its rate of overweight and obesity. It doesn't seem to just be a wealthy country problem anymore. And as far as I'm aware, no country has really managed to turn this around. So there really is an obesity epidemic here. You're
obesity
involved.
Pandemic.
That's
yes.
right. That's right. A few pandemics going on at the moment. You're involved in numerous organisations, globally and locally. Could you give us a brief overview of what you're involved with and some important works that's going on at the moment?
So I got involved in obesity in the 90s. I was still doing research in it, and I wanted to get this kind of up on the New Zealand agenda as well as on the global agenda. So, for me, I look back at the 90s and think, wow, that was a decade of advocacy just to get this problem on the agenda. It's amazing how long it takes. But that was kind of the 90s. And towards the end of the 90s, some of us were getting frustrated with the lack of recognition at a global level as well. And Philip James from the UK started this group called the International Obesity Task Force, which I joined up. And that group really forced WHO to take it seriously, and then it got on the agenda with WHO in the early 2000s, and that was a great job of work that IOTF did, and then IOTF morphed into World Obesity, and I changed from being a co-chair of IOTF, the International Obesity Task Force, to being co-chair of the policy and prevention part of World Obesity, to try and just get this issue up on the agenda. So that's been a part of my work globally. And then when I was in Australia for 11 years at Deakin University, I started, as you mentioned, the World Health Organization Collaborating Centre for Obesity Prevention. So the World Health Organization has pretty much zero capacity to do any research or have major academic input. So it relies on these collaborating centres worldwide. There's about 700 or 800 of them. And at the time, and still actually, it's the only collaborating centre for obesity prevention per se, which is staggering when you think about the size of the problem that the world is facing. But anyway, that's been very valuable. That's still going at Deakin University, and doing excellent work there at a community level and national and international level.
And then closer to home, you've also had some input with the Health Coalition Aotearoa.
Yeah, so part of my international work has also been working on large policy intervention approaches for obesity and food policy globally. And it all started off actually when Bloomberg Philanthropy, so this is Michael Bloomberg's philanthropic organization based in New York, and that guy really gets public health. He really understands public health. He was mayor of New York City, and he's now the non-communicable disease ambassador for UN and so on, and he really gets it. And he wanted to do something globally about obesity. He was already doing a lot of work in tobacco control and motor vehicle crashes and so on, but he wanted to do something about obesity. So a group of us convened at their place in New York and put the case to him about where he could put the money. And he said, well, I'm a data guy and you guys haven't shown me anything that shows how to turn this around. And we said, well, that's true. This is not like tobacco where you can look at a country like New Zealand and see that we've gone up and then it's come back down again, or motor vehicle injuries or smoking, and all those sorts of things. It's just been going up and up in every country. But anyway, credit to him and his philanthropic group. They dipped their toes in Mexico and they said, we're going to see if we can get some food policies up. And so they funded in Mexico a coalition of NGOs and academics and people to push for a sugary drinks tax and a junk food tax. And so they funded a group to do the communications, they funded a group to do the science, they funded a group to do the sector coordination, and they funded a group to do the lobbying. And I thought, wow, that's how you get stuff happening. And it worked in Mexico, and now Bloomberg is funding about another dozen countries, and he's just put out $250 million to fund other countries to do the same, to get that pressure of demand for policies out. Now, Bloomberg's never going to fund New Zealand, but we thought we need to find a way to do it ourselves. So we founded Health Coalition Aotearoa, and we actually joined up the harmful products that dominate in the New Zealand environment. So that's tobacco and alcohol and junk food. And together, those three things create 1/3 of our health burden, 1/3 of our diseases, disabilities, and premature death. So we joined those up and said, these are the harm products that we need to get policies in place for. And Health Coalition was founded. About 60 odd organisations, several hundred health professionals all signed up, and we want to get some action on policies in this country to get much better prevention than we've got now.
Yep. And you're also leading the charge for Informus in New Zealand. And for anyone who's not familiar with that, that's a global network benchmarking for food systems. And New Zealand actually achieved a world first, didn't they, by undertaking that comprehensive food environment and policy survey. So what were the outcomes to that? Were they very positive or not so much?
Well, they might be what you expect, Emma. So, you're right. In Informus, we started in 2012, and we thought we need to start measuring food environments in a systematic way so that everybody's using the same tools so we can compare over time and across countries. And we developed a set of tools, and we got funding to apply all those tools in New Zealand. So, we were the first to have a comprehensive food environments surveys in New Zealand. But, with the number of countries that have picked up these protocols and are now implementing them, I think it's over 60 countries now. So there's a real need for that. And it's been fantastic to see the uptake. The bottom line is unhealthy foods in this country are absolutely widespread. We've got food swamps where they're concentrated in more disadvantaged areas. We see the price of healthy foods going up much more steeply than junk foods. We see junk foods widely available in schools. We see them heavily marketed to children, and we see an absolute lack of government policies to do anything about it over the 9 years we've been measuring government action on policies. So it really is a place where government can really pick up the game if they want to make a difference especially in child nutrition and child well-being. It's just a no-brainer to me.
Yeah, and you've been very outspoken on the issue of marketing of these hyper-palatable, highly processed junk foods to children. And I mean, rightly so. Around 1 in 10 children in New Zealand are obese. 1 in 4 children in Australia are overweight or obese. It's really sad in this day and age that there's still a lot of blame placed on the individual when it's very obvious that the food system needs an overhaul. And to use your own word, it is an obesogenic environment. And I was reading your Informus report and found that children were getting 8 ads per hour for unhealthy food on TV during the children's peak viewing time. So that just blows my mind.
It's a joke. The industry has its own code, which of course is a complete waste of time. That's like setting your own homework and then marking it. It is just a total failure. And there is zero regulations in this country protecting children against being exploited on marketing of junk food, which is one of the biggest harms that's caused of children. And that's the visible stuff, the 8 ads an hour. That's what you see on television during children's peak viewing time, which of course is at the same time that adults are watching, 7, 8, 9 at night. That's not all the invisible stuff. All the digital media, the stuff that's coming across on their feeds, on their phones, and so on. So, we really, really do need government to step into this space and bring in some regulations.
And that's notwithstanding, obviously, the way products like cereals, high sugar cereals are marketed, cartoons, or there's cards to collect or toys and so on, and also the way supermarkets are laid out. What are your thoughts on when people campaign for sugar taxes? I mean, is that, excuse the pun, sugarcoating the issue here? You're not going down to the root of the problem, are you?
Well, if sugar taxes were nothing, then the industry wouldn't be fighting so desperately hard to not have sugar taxes. They are probably the single strategy that has the most evidence behind it. Now, if you want to do something about childhood obesity in this country, there's no one single magic bullet, right? It's got to be lots of things. And each of them have their own bits of evidence. And collectively, if they were implemented together, then you could imagine that they would really make a difference. But when you look at the pieces of evidence individually, the amount of data now stacking up supporting sugary drinks tax is amazing. And a lot of it is thanks to Bloomberg and his obsession with data. So when the sugary drinks tax came in Mexico, when all the front of pack labeling stuff came in Chile, those sorts of things, he funds the evaluation to the nth degree. So there's really watertight data of the impact of these policies, which is just fantastic, because often that kind of evidence generating evaluations are not present when these big policies come through. So, there's more evidence for that than anything. But it's going to take a comprehensive approach, and we haven't seen any governments go anywhere near it at all for the last 10 or 15 years.
Well, it's a hard slog, because you're up against hugely powerful corporations and industry body, and a lot of this food industry, they're using similar tactics that the tobacco industry used to influence policies and perspectives. What can I do as a health professional? What can the health professionals doing? How can we amplify your voice here? What can we do to speed this along?
So the lessons that I take from all the work that's happening in mainly Latin American countries funded by substantial money from Bloomberg, but also our lessons from around the world. In this space, which is just stuck, what we call policy inertia, we're not getting anywhere despite the evidence. And that's due to three things. It's due to industry opposition, the vested interests. It's due to government reluctance to tax and regulate and legislate. And it's due to insufficient demand from the public, from the health professionals, from NGOs, insufficient demand for these policies. Now, out of those three, I think the most movable is lifting the demand. And, if you do polls of the public and say, do you support having only healthy food in schools? Do you support restrictions on junk food marketing to kids? Do you support proper front of pack compulsory labeling of foods? Do you support a sugary drinks tax? They all come in with resounding majorities. So this is popular, but the level of support, the type of support, is a quiet support. It's not a noisy, demanding support. And I think the lessons that we've learned from Mexico and other places is that we have to get organized, and we have to get the voices of communities We have to get the voices of the people who are struggling themselves with obesity or with alcohol addiction or whatever it is, and we have to get the voices of the health professionals who are seeing this and bearing witness to it. And if we can collectively pull that together, and this is the whole purpose of Health Coalition Aotearoa, if we can get that collective voice, these are well-respected voices. The community believes them, the government listens to them, but they're just not kind of demanding enough, I think, and that's our job. We have to be very specific and very, insistent on what we want for our children.
Now, when you make reference to healthy food, that term, that can still mean anything. Now, the Eat Lancet report even stipulated in there, I can't tell exactly where, but I know I read it in there, it classified meat as an unhealthy food that needs to be consumed less. We know the effects of animal products on health in general, and even its possible contribution to obesity to some degree as well. Where does that sit? Because in New Zealand, we know that beef and lamb and dairy are our two biggest export industries. We know that is where a lot of our challenges are in terms of the environment itself in New Zealand. So when we talk about influence, we talk about who's pushing who. Where does that all sit in this big picture in terms of the guidelines and making recommendations around that?
Well, that's the challenge that we took on for the Lancet Commission on Obesity when we were asked to. I co-chaired that with Bill Dietz from Washington, and we were asked to rethink obesity. And it's true that obesity has been thought about in isolation, even in many middle-income countries where they still have a lot of undernutrition, child undernutrition, starving kids. They have a lot of obesity and diabetes. And yet it all comes from the same food system. So this single food system operating in a country like, Malaysia or Colombia or Vietnam or something like that is supporting and promoting a whole bunch of obesity and a whole bunch of undernutrition. And so malnutrition in all its forms, joining these together, is a product of the food system. And if you're a systems person, if you're a systems thinker, then you'll say, well, this food system is delivering as it's designed to deliver. It is delivering obesity and it's delivering undernutrition because that is the way humans have designed it, which sounds a bit harsh, but a systems scientist would always say systems always deliver what they're designed for. And you're quite right that in New Zealand, for example, food systems or food exports are a big part of our prosperity. That's why we're a wealthy country to a large degree. And so universally, pretty much, food is considered to be an economic commodity. An economic commodity, and the purpose of the food system is to create livelihoods and profits for those engaged within the food system and to feed those people who can afford to pay for it. That is the purpose of the current food system as designed. Now, as I've said, this is causing a hell of a lot of undernutrition and obesity. And in this country, it's also causing a hell of a lot of food insecurity. 20% of children in this country live in households with moderate to severe food insecurity. So it's producing all of those health and well-being problems. And then you look on the environmental side, which you were talking about in relation to meat and beef and lamb and dairy and so on. And you say, okay, what's happening on the environmental side? Well, 50% of our greenhouse gases in this country are caused by the food system, almost all of them agricultural, from methane and nitrous oxide emissions. And what's the cause of our dirty rivers? What's the cause of our deforestation? What's the cause of our loss of biodiversity? All these big environmental issues. The food systems that we have developed are right at the core of it. So what the what we tried to do in the Lancet Commission on Obesity was call these things the global syndemic. So a syndemic is a synergy of pandemics, all having common cause, common drivers, and negatively interacting with each other. So, climate change is going to cause undernutrition and so on. And if you're born undernourished, you're more likely to become obese and so on. But the fundamental thing we wanted to do was to get people to look beyond the visible manifestations, what they see. Here's a problem with obesity. Here's a problem with undernutrition or food insecurity. Here's a problem with greenhouse gases or loss of biodiversity caused by the same problem. We've got to look through those visible manifestations and say the underlying cause is within our food systems and the way we design them. So what we're trying to say within the Lancet Commission was, let's repurpose the food system. Let's say the food system has to deliver on human health and well-being. It has to deliver on social equity. It has to deliver on environmental health and well-being. And it has to deliver also on economic prosperity. We still want our prosperity. So those are the 4 outcomes that we want food systems to deliver. So we've got to go right back to the drawing board, really, and start redesigning our food system so we don't have all these negative consequences.
Yeah. I mean, obesity, it's obviously a wicked problem, as is climate change. So there's no one silver bullet. But as you say, the current food system is definitely tangled up in both of these issues, and it's clear it needs an overhaul. I'm just thinking about the current pandemic, COVID-19. The countries that have taken the most radical approaches there seem to be having the best outcomes. So how can we kind of, shift the gears in the nutrition world and the food system world and get these actions happening?
Yeah, that's a great question, Emma. And, there's lots of really negative things that have come out of the COVID pandemic. The first of which was the huge spike in food insecurity. So many people just above the breadline. There's too many people below the breadline, but so many just above it. And then one hit like this, like a lockdown, and suddenly the queues at the food banks are just going right round the corner. So lots of bad things come out of that. The good things and the solution-oriented things that I see are that we have here in Australia and in New Zealand and also in Australia, we have governments that have done a number of things right. And what are those things they've done right? They have taken this thing seriously, and they have prioritized public health, and they have looked at the evidence, and they have listened to the experts, and they have been prepared to keep changing their grounds as the evidence changes, and they've been prepared to put in bold policies and communicate it well and evaluate it. So that's a whole string of responses to a really severe threat that we would like to see applied beyond COVID, please. Can we take this COVID approach and can we apply it to some of these big ticket items, these chronic problems that we just haven't been dealing with? And really, if we can get that type of thinking into it, then that would be great. And if we can get that kind of thinking about the food system, which is so important to all New Zealanders, that would be great. And, there are moves afoot in doing this. Just last week, I was at a meeting of Aotearoa Circle. So Aotearoa Circle is a government and private sector collaboration where leading people in the private sector and leading agencies within government are wanting to see some collective action, largely around climate change that came out of it. And climate change is big ticket items of transport, energy, and food. And so I was on this food group, and we're thinking about, okay, how can we get a comprehensive food strategy for New Zealand, which is going to deliver on those 4 outcomes that I talked about: health, equity, environmental, and economic prosperity. So that is our challenge. And so, I hope that with the work that Aotearoa Circle is doing, and is going to come out shortly with some approaches. That's another opportunity for individuals and organisations to jump on board and demand at the policy level we take this seriously.
Now, I was reading your brilliant article called Power Dynamics in 21st Century Good Systems, and you mentioned some triple duty actions there. I'm sorry to put you on the spot. I hope you can remember these. Would you mind just talking us through those and why they're so potentially impactful?
So thanks for that, Emma. So the triple duty actions came about, when we looked through at this global syndemic to the underlying causes. There's lots and lots of reports around the world, authoritative reports. I could stack them up, probably about 6 feet tall, on nutrition and obesity and so on, with hardly any of them implemented. And so we were looking through those manifestations and say, okay, what if we did something really fundamental at the food system level or transport system level that would make a difference and have an effect on obesity, on the undernutrition and food poverty, and on climate change. And so to give you a simple example, which people can readily relate to, what about healthy, sustainable dietary guidelines? How about even just a bit of concerted advice and communication to the public about what it means to be healthy and sustainable? And Ben mentioned this before about the beef and dairy and so on. And actually, to get that message across, if you want to be healthy, the first thing you got to do is get rid of the ultra-processed foods. If you want to eat sustainable, the first thing you've got to do is turn plant-based and move away from those products that are creating a lot of greenhouse gases. But that's not an easy set of messages, and there's lots of nuances at the edges. It's a big job of work to create a set of dietary guidelines which promotes health and well-being, which promotes environmental sustainability, which promotes social well-being. Actually, don't forget the importance of food as a social and cultural entity. Brings all those things together. That's a big job. That's a pretty basic job that we need to get down to. But there are other things as well. One of the things that is critically important is to get the conflicted commercial interest voice out of policy making. Now, this might seem a bit deep and a bit obscure to people, but what is the reason we don't have good, strong policies around food, around alcohol? Tobacco, we're doing pretty well on. That's got a bit stalled. It looks like it might be moving again now, but I mean, particularly around food and alcohol, because the very strong lobby forces are putting a regulatory chill on government. Government do not want to do battle with them. And so when any policy starts getting developed, in they come, sitting at the policy table and kill it. So we really need to get rid of those voices. And if I can just digress slightly, Emma, about today, having just come from the High Court in Auckland, where we had a court case which was settled today. This is a court case which has been running for 5 years, came out of the Dirty Politics book, where it was exposed really for the first time, the evidence. This is from a whole bunch of hacked emails, but the evidence that there is this model within the harm industries where tobacco, alcohol and junk food industries are paying dirty PR tactics to be employed to denigrate, to defame public health advocates like myself. And then all that stuff ended up as toxic blogs on the whale oil website in the public arena, and we were defamed and denigrated. Well, we've had a very climb down, humble, fulsome apology from Carrot Graham, who was the dirty PR middleman in all of this, confirming that in fact this was how it operated. So I hope that clears the way for more public health people to stand up and advocate for these policies. I hope that people who might be getting into this dirty PR business like he has been involved in might think again. Maybe those harm industries might think again before funding this kind of this dirty PR approach. So anyway, that's been a long battle and a very hurtful battle for a lot of us, and I'm glad that that's over. But anyway, that just happened this afternoon, and so that's what I mean about trying to get these big influences, these big commercial influences, out of policy making.
Yeah, well, you did come onto the show, onto the call this afternoon with a big grin on your face, and when you told us, it's certainly, initially we want to say congratulations, but you had to endure that for so long. And the interesting thing is this is not new in terms of does it actually happen, but you read of what happens in the US a lot. That's where you hear it of. But the fact that kind of approach, those kind of dirty politics happens right here in New Zealand and in Australia for sure, just makes it's a reality check. And it's certainly one of the hurdles that we are up against, because when Emma asked earlier, what can we all do? Health professionals, the general public, parents of concerned kids, it's where the confusion comes from, isn't it? That's exactly what it is. It's health professionals might present or educated individuals might present science, but then why we're not following the science is because everyone else is so good at just confusing us. And then you just go with what you see or hear the most, and that's where marketing, advertising, and so on plays a big role.
So the confusing messages come about from a very deliberate policy, which was first developed by the tobacco industry as the evidence mounted against them, and it was just uncontrovertible evidence, really. And they clarified to themselves and their PR people that the product that they were selling was doubt. Doubt.
Yeah.
Just seed the doubt in people's minds. And there was a fantastic book called The Merchants of Doubt, which uncovered all that. So it's not that they go out and say, smoking doesn't kill you, but, there's a whole lot of other things. There's genetic issues and, there's evidence is a bit uncertain here and blah, blah, blah. And that is what's happened, what we've seen with climate change, what we've seen with junk food, that they can't come out against the science and put counter evidence there, but they just see doubt in people's minds that this really isn't true, or there's only some people agree with that. And there's a whole lot of climate scientists that don't agree with the fact that climate change is happening and so on. They just see those doubts. And, that's really what we're up against. And it's actually quite hard to counter it, because once you start dealing with their arguments, you start repeating them, and it may even make the whole thing worse.
Yeah. And actually what you mentioned is exactly what I've been reading now. A lot of our guests make reference to the China study by Dr. T. Colin Campbell, but his most recent book, The Future of Nutrition, he talks exactly about that. It's there might not be science countering the science, so you plant that seed of doubt. And you make references that just in our minds don't make sense, but that's what they do. Those comparisons that, again, don't make sense, but it's confusion, it's doubt, and hence where we are right now.
Hence where we are right now, exactly.
But we've also got to deal with the fact that the economic system as well. We're quite privileged right now to be able to sit here and have this discussion, but a lot of people are just, trying to get through their day, and they're exhausted after a really long day's work. They go to the shops, they look at whatever's the easiest thing there. The first thing that they see is convenient, hyper-palatable foods. Even the design of supermarkets can play into all of this.
Oh, totally. The whole thing is designed, This is choice architecture. It's all designed to create our choices for us.
So in your mind then, what are the most important things that we can try and address first? Because I know we've covered a lot of, we've kind of undulated through this conversation, I apologise, but like the big ticket items to concentrate on, top three potentially.
Okay, well, on the food side, and sorry, I am going to preface it by all these problems are big, difficult problems, and there's going to be no single magic bullet, and it needs a comprehensive approach, and right down to the infrastructure around conflicts, getting conflicts of interest sorted out, getting good monitoring and evaluation, all of those sorts of things. But if you're looking at what are the big ticket items for policies around food, the big three that we put forward as the Health Coalition Aotearoa. Number one, sugary drinks tax. We've already talked about that. In fact, sugary drinks tax or even a junk food tax on ultra processed foods. So that would be number one. And unfortunately, in this country, the government seems to have this term ruled out these kind of taxes, which is really putting one arm behind their back if they want to do something about childhood obesity. But anyway, that's as it is. But the evidence is just mounting all the time. The second is regulations on junk food marketing to kids. There's a whole groundswell of action and demand starting for this. This government has to do something about child well-being in the space around food, and getting regulations in that protect children, to me, is just a no-brainer, and it's a no-brainer to any parent or any feeling citizen in this country. So I want to see regulations come in for that. The stuff that's there at the moment that the industry runs is just a nothing. And the third is healthy food in schools. My goodness, why can't we have healthy food in schools? Now, government has been very reluctant to push ahead at a policy level for that and say just create policies around how kids are fed in schools and the type of food that's allowed to be sold or provided in schools. For some reason, they're reluctant to do it. I think they're scared of being called a nanny state or something. Anyway, but what they have done as part of the COVID response is to put a whole bunch of money into $220 million into free school lunches for kids in the 25% most disadvantaged schools. And so that really, I think, is a potential game changer. And, that would be really great if we could use that as the sort of the first major big food system change that is coming to communities. And that's a big deal. I'm working in the Hawke's Bay. The 60 schools in Hawke's Bay that are getting this free school lunches, that is a big chunk of the schools there. That is a big change to food systems for kids in a place like Hawke's Bay. And, we need to capitalize on that. What we don't want to see, which is unfortunately the way it could go, and there's some signs of that, where the contracts to supply this just go to the big commercial caterers. And unfortunately, in the rush to kind of get these contracts out the door, that's a bit of a risk. But I'm really hoping that what we can get from the school food initiatives is school food ecosystems or community food ecosystems centered around healthy food at schools. Now, if we get this right, this can create a number of real positives. First of all, it's going to feed kids that come to school hungry, but it's got to do more than that. It's got to nourish the kids. It's got to give them healthy food. And more than that, we hope it's going to help with family hardship, that it's going to reduce the food insecurity at home. You imagine you've got 3 kids that you've got to send out the door every day with lunch, and if you don't have the headspace or the capacity to do it, and then they go out the door with $10 each, for their lunch or something, could be a big win for family hardship. It could be a big win for resilient food systems. So let me come back to COVID. We had this lockdown, and that was a huge hit for a lot of families. Money and income dropped, and where are they going to get their food from? Well, if you've got a local food ecosystem that's used to delivering food and has all the systems in place and the people that know everybody and the supply lines and so on, and they're used to feeding kids, and then COVID hits and there's lockdown, actually they can be reoriented to feed families. That's a great characteristic of a resilient food system. That'd be great. It could, in the end, actually also contribute to a whole lot of education outcomes, school attendance, those kinds of things. Schools that have good food systems where they provide healthy lunch, they just report all sorts of positive outcomes for the kids. Behaviours, attendance, obesity, obviously, better skin, fewer infections, lots of things. I don't know how much of that is just anecdote or how much is true, but boy, it's a consistent set of stories. So there could be a whole lot of ramifications there. And, from some of the food systems that we saw, some of the food supply to schools just in the early days, there's quite a lot of plastic being included in the schools, and kids see that, and kids are attuned to the environmental costs. So actually, these could also even play into this whole food sustainability approaches. So, I've got a lot of high hopes for it if we can kind of get in there and evaluate and measure it, and give these local school food ecosystems a chance.
Brilliant. So from linear to circular systems, basically.
Yeah, totally.
Fantastic.
Look, having done a number of school visits in the more high deprivation areas in the Waikato over the years, when you first mention about, healthy foods or simply just providing foods to the schools, my first thought, and it's because what I see is it's your local dairy company that goes and supports it, and it's a lot of the wrong sort of companies or businesses that get involved, because it's not quite the foods we want to see. However, I have seen personally, and I'll mention this one school, it's Pairoa, which is right at the top, almost Bay of Islands, but it's Bay of Plenty, sorry, but it's still in the Waikato, small little town, and their primary school, they have exactly what you talk about. They have this massive veggie garden where they grow as much as they can themselves, and the kids are free to wander in and take what they need, what they want. So it's this whole self-dependence. You can go and help yourself, and you can even take some back home. So it's creating those little ecosystems, which is possible, and it's already happening. There's some fantastic success stories out there. But I think more, like you say, that's what needs to start happening more of. And there's a lot of other fantastic initiatives happening with these schools in terms of the environmental aspect as well. But there's huge potential, but it's like you say, who's going to jump on that at that opportunity first, and is that going to block the real good intentions and the real good outcomes that can happen, but unfortunately takes a little more time to eventuate. So
yeah, it does, and what we don't want to end up with is a handful of big companies providing it just in it'll come down to a transaction. This is money going one way and feeding kids the other, making profits for the big guys.
It's part of that whole process.
It's part of that process, and all of these other positive things that could potentially come out of it that I've talked about will fail to materialize. So I think it is a real opportunity that we have to support. And if I can just mention one of the other characteristics of the food system, which became very apparent during COVID, which could also be picked up by these local food ecological systems. If you think about the food supply chain that goes, it's not actually just a linear thing, but if you think about it as a linear thing from production, manufacturing, distribution, retail, and so on, there is a point where the food system, the food chain bifurcates, and one arm of it goes into food service, into the restaurants and the cafes and the, catering and all that sort of stuff. And then the other arm goes into household. Now, what happened with COVID is that with the lockdown, that arm that went into food service stopped dead, and all the food piled up there. And the arm that went into the household, yes, it was still open there through the supermarkets, but the households didn't have the money. Many households didn't have the money now to go and purchase it. So we had a whole pile of food stacking up here and a whole lot of need over there from families that needed it. So what joins these two things up, and what joins them up, is voluntary food rescue organisations. And so this is volunteers largely. Many of them are actually retired and should have been home sheltering from COVID and, not out there dishing out food. But it's a volunteer patch up to a system that is not working in a fundamental way. And so, yep, there are food oversupplies. There's stacks of apples that don't get to market because they're a bit small or a bit, whatever. There's food that goes past its used before date. There's excess left over from the bakery and so on. And there is this food excess, and nobody wants to see it go into landfill. But can some of it, at least the healthy stuff, get transferred into local food ecosystems that help support families that are struggling with food? So in other words, bring it centrally into how the food system operates, not have it as a tack on just from volunteers who are desperate not to see this stuff go to waste and into landfill. We've got to do much better at joining these two arms of the food chain, so that we don't get the landfill and people that need the food get it.
Now, talking about opportunities to improve processes and systems, our government in New Zealand recently announced a climate emergency. There has since been the establishment of a climate change commission. From a diet point of view, that is something that a lot have observed is very little mentioned as part of that, which I think we can all agree is actually a big component of climate change, what we eat.
It's only 50%.
Only. So let's not make a big deal about it. But how do you see, where do you see the opportunities there in terms of how we should be inputting into the commission, I guess, as a whole?
Well, I was pleased to see at the end of last year the government declare a climate emergency, but I was very sad and disappointed to see that the government did not say anything about food. Even within its own system, it talked about within the whole government complex of where government money goes and where government money gets spent. And they talked about fleets of electric vehicles and making sure that each government department, reduces its climate footprint, and that stuff is good. But the food system was not mentioned. And then we get this huge report, 188 pages from the Climate Change Commission, and it did talk about food, but it talked about it in a very productionist way. It didn't talk, the word diet didn't appear in the 188 pages. Now, we have got a team of 5 million that eats food every day, and what we eat has a huge effect on our health and our environment. And we need that social movement. We need a change in how we think about food and how we use food and how we eat food and share food and so on, in a way that is conducive to health and conducive to the environment. And the fact that the Climate Change Commission didn't see that kind of human element, that social movement that's needed to change our diets, change the demand side of the whole food dynamic, to me was just such a gigantic blind spot. So if anybody out there is going to write a submission to the Climate Change Commission, and please put in a plug for diet. if we change the demand side and start demanding healthy and sustainable food, and demanding that it's disclosed, the carbon footprint of food as well as the healthiness of food, disclosed on the label or whatever, we will be in a much stronger position to influence the growers and the providers, and also in food procurement. The government buys a lot of food. It's buying $220 million of food for these kids in the lunches, just for a start, plus all government departments, plus prisons and armed forces and so on. They can do a lot, and so can cities and municipal local councils can do a lot. And there are good examples of that around the world. I know, for example, in Copenhagen, and there in Copenhagen, the city is responsible for the food for the schools. And so they said to their suppliers, they say, okay, people, in 5 years' time, we're going to be buying organic, period. And so you've got 5 years to get your acts together to supply us all organic food for school food. And so there you have a purchaser, a big purchaser like a city, that has a big influence on the food supply by saying, you're not going to get a contract with us until your foods meet these standards. So, governments can do that. But I've seen no sign of that kind of thinking getting into how government is responding to this climate emergency.
But then it probably goes back to your earlier point, on the side, the government allocates a massive budget to clean up rivers when we all know you're not going to the root of the problem. So it goes back to that earlier point of yours, where is the government still being influenced by, the big corporates, the big industries? And I think we can pretty much figure that answer out. It absolutely still is. I mean, if it's still a big contributor to our GDP, there's a deeper change that needs to happen. Yeah,
and if government said, okay, we're going to continue, for example, to fund $220 million to the most disadvantaged 25% of schools, but for the other 75% who still have big problems with obesity and poor nutrition and junk food intake and so on, we're going to have a policy that says, schools need to have a written, strong food policy, and that no schools, sell or provide food that's unhealthy to their kids, and they encourage any food that comes into the schools bought from home to be healthy. And you've got to have a food policy that you're going to stick to that's on your website. They could do that for the other 75%, and that would be great. That would really then start to help to create the social movement which is needed around changing diet and dietary practices.
Well, we're very good at raising a lot of problems and a lot of issues, but we would like to...
Hey, come on, I've been talking about solutions.
But we do like to finish on a positive. So as your parting shot, what would be your final sort of, for our general listeners, so they're not all health professionals and they're not all, policy writers and so on, but for the general public, what would be your biggest sort of advice in this regard?
So in our Lancet Commission report on obesity, we tried to reframe the role of the individual in this. Now, typically in obesity, the role of the individual is characterized as you are responsible for what you put in your mouth, and therefore, if you have a weight problem, it's your fault. That's how individual responsibility is characterized. And it's a very shaming, a very damning approach, and it is unsympathetic and unempathetic to the places that these people are in. We tried to define individual roles much more broadly. So I'm an individual and I live in a family, and I can have influence within that family and within my close friends and close social circle by my actions and my kind of personal actions and advocacy within that circle. I live in a workplace. I go work in a workplace. I can have an influence in my workplace about what kinds of foods are offered and what kind of policies and things are there. And, that can have an influence. If I'm a shopper, I can have an influence with my dollar. I'm a voter. I have an influence with my vote. I can be an advocate within my professional organizations. I can join other movements and make my voice heard. I can be a public advocate at my school. I can be on the board of trustees. There's lots of different roles, many, many different roles that we as individuals play within society, not just the role of putting food in our mouth. So what I want to alert people to is think about all of these roles where there are opportunities for linking with people and trying to influence in the way that you can towards healthier and more sustainable food environments. If we can do that and 1,000 candles get lit around the country, that then lights another 1,000 candles, then we'll start to get a little bit of light on this matter.
That's brilliant. Boyd, I want to thank you so much. Your passion for public health advocacy and food systems, it's inspiring. It's clear that our food system is no longer fit for purpose. And if we want good human and planetary health outcomes, as well as progression on social justice issues, things really do need to change. So thank you so much for all of your hard work in this space. I know it's been a slog, but I'm so appreciative. Thank you very, very, very much for coming on and spending some time with us.
No, total pleasure, and thanks for the call, Emma and Ben. Really appreciate it.
Thank you for listening to the Lentil Intervention podcast. If you found this interesting, make sure you subscribe and share it with your friends.